Hey, hon, you have any good news for me today?
Hey, I do have some good news. I had someone reach out to me to thank me and to let me know that their request to an exception to the formulary for their drug coverage was granted. So what does that mean? So if you have a Part D drug plan, standalone, or a Medicare Advantage plan with your prescription drug coverage built in, then you always have a right to request an exception to the formulary. And the formulary is the list of medications. So when would you make this request? Well, one would be the drug that you are on is covered, but it's a high tier, like a tier 5, a tier 4, and you can ask them to lower the tier, therefore hopefully lowering the copayment or the coinsurance amount. Number two would be they don't cover the drug at all, brand or generic, and you could say, hey, can you cover this drug? And maybe they will, maybe they won't, but you always have that right. Now, in every case, you always need to get your doctor to write a compelling note for the request to the insurance company, and they typically have 72 hours to let you know. And then the other, probably most prevalent one would be, let's suppose you're on a medication and there's a generic version for it, which usually means that's all they cover, not the brand, but the generic doesn't work well for you, but the brand does. This would be a case where you could request an exception to the formulary. They don't normally cover the brand, but they would for you. Now, they might not put it on a tier 1 or tier 2 like a generic, but they may treat it as a regular brand, but it would at least be covered. So those are the three reasons, the main reasons why you can request an exception to the formulary. It's very helpful because it gets you the medication that you need and it saves you money. If you are from one of the 17 states I'm licensed in and you need good solutions for your Medicare coverage, by all means, reach out to me. I'm Chris Prang, the Medicare analyst. Make it a great day.